Welcome back to Biologic Health, where we bring you science-based, accurate, and eye-opening health information to help you live a better life. Today's topic is a question many women secretly wonder about but rarely ask out loud. What actually happens to a woman's body, especially the vagina, when she goes a long time without sex? There are a lot of misconceptions, a lot of myths, and also some real biological changes that many women experience. So, in this detailed video, we are going to break down the real science, the facts, and what doctors actually say about long-term sexual inactivity. And remember, for more important health advice like this, make sure to subscribe to the channel. Let's begin. Number 1. Myth versus reality. Does the vagina close up without sex? One of the most widespread myths is that a vagina shrinks, tightens too much, or even closes up if a woman doesn't have sex for a long time. This is 100% false. The vagina is made of elastic muscular tissue, designed to stretch during intercourse and even childbirth. Because of this elasticity, the vaginal canal does not close, collapse, or disappear due to lack of sexual activity. However, although it doesn't close, certain functional changes can occur, which we'll explain next. Number 2. Changes in natural lubrication. Regular sexual arousal increases blood flow to the pelvic region. This helps maintain healthy vaginal lubrication. But when a woman goes months or years without sexual activity, whether with a partner or alone, some changes can happen. Natural lubrication may decrease. The vagina may feel drier. First few attempts at intercourse may feel slightly uncomfortable. This does not mean anything is wrong. It simply means blood flow and hormonal stimulation have been lower for a long time. The good news: lubrication usually improves again when sexual activity resumes. Number 3. Vaginal elasticity and muscle tone. The vagina has collagen and elastin fibers that help maintain strength when sexual stimulation is absent for a long period. Elasticity may slightly decrease. Vaginal walls may feel a bit less flexible. Initial penetration after a long break may feel tighter. This is commonly seen in women after long periods of celibacy, childbirth, recovery, or long-distance relationships. Again, this is not permanent. With regular stimulation, whether through partnered sex, solo masturbation, pelvic floor exercises, elasticity improves naturally. Number 4. Pelvic floor muscle changes. During orgasm, the pelvic floor muscles contract rhythmically. This works like a natural exercise for the pelvic area. Without sexual activity, pelvic floor strength may reduce slightly. Muscles may feel less responsive. Some women experience weaker orgasms when they resume sex. However, this is easily fixable by Kegel exercises, general physical activity, orgasms solo or partnered, yoga, and pelvic strengthening workouts. The pelvic floor responds quickly to training. Number 5. Impact of menopause. The most critical factor. For younger women, long-term sexual inactivity usually causes minimal changes. But for women in perimenopause or postmenopause, hormonal levels play a huge role. After estrogen levels drop, the vaginal tissue becomes thinner, drier, more sensitive, less elastic. In this stage, regular sexual stimulation, even if through solo activity, helps maintain blood circulation, lubrication, elasticity, comfort. Women who never stimulate the vagina during menopause may experience vaginal atrophy, a condition where the walls become very dry. The canal narrows. Intercourse becomes painful. This is why gynecologists often recommend vaginal moisture estrogen creams. Lubricants. Regular stimulation, solo or partnered. Number 6. Does not having sex affect overall health? Research shows that long breaks from sex may affect some women. Higher stress levels, more irritability, sleep disturbances, lower mood. This isn't universal. Many women feel perfectly fine without sex. But for others, the hormonal benefits of orgasm, such as release of oxytocin, endorphins, and dopamine, help regulate stress and mood. Number 7. Emotional and psychological effects. Regular sexual activity creates bonding, intimacy, emotional closeness, confidence, positive body image. Women in relationships sometimes report feeling distant, less emotionally connected, more easily stressed when sexual intimacy disappears for a long time. However, these effects depend heavily on the individual and the relationship quality. Number 8. How solo sex helps maintain vaginal health. Masturbation is completely normal, healthy, and medically supported, especially for women who are not sexually active. Benefits include increased blood flow to the vagina, maintaining lubrication, preventing stiffness in the vaginal walls, stress relief, improved sleep, hormonal balance. Gynecologists often say, if you don't use it, stimulate it, meaning, even if you are celibate. Occasional solo stimulation helps maintain vaginal tissue health. Number 9. Recommended ways to maintain vaginal health without sex. Pelvic floor exercises, Kegel workouts, aerobic activity, vaginal moisturizers, estrogen therapy, if menopausal, adequate hydration, self-stimulation, if comfortable, avoiding excessive douche, eating foods rich in omega-3 and vitamin E. Healthy lifestyle habits keep the pelvic area functioning optimally. Number 10. When should you see a doctor? Seek medical advice if you experience painful intercourse, extreme dryness, bleeding, painful pelvic muscles, burning sensation, changes after menopause. These symptoms may indicate hormonal imbalance, infection, or atrophy. Sexual activity is optional, not a requirement for health. But understanding how your body works ensures you stay confident, informed, and in control of your well-being. And remember, for more important health advice like this, make sure to subscribe to the channel. Thank you for watching Biologic Health.